Story 1. I have inoperable, aggressive, rare cancer. The last line of defense cancer drug stopped working. I am all for it. Thank you, Reddit, for making the last few years of treatment more bearable. Story 2. We allow this option for animals we keep as pets and livestock. I see no reason we shouldn't offer a much-needed reprieve from suffering to a person who will not improve and is suffering greatly. Story 3. As someone with a disability, I fully support this. We should be able to live our lives with dignity and end them in the same manner. Story 4. I am in Canada, where medical assistance in dying is available and regulated. I'm in my mid-40s. A guy I grew up with recently had his wife, who is the same age, choose this option. She had previously undergone cancer treatment, but the cancer returned and spread to her bones. For those who are unaware, bone cancer is one of the most agonizing ways to suffer. The pain can be so intense that even the strongest opioids cannot alleviate it. Instead, she was able to say goodbye to her friends and family, passing peacefully with them by her side on a lovely spring morning. Was it hard on everyone? Yes. But it was far better than enduring the relentless suffering caused by bone cancer. Story 5. My father-in-law chose to go this route in August. He was 81 years old and in extreme pain from terminal cancer. We all miss him dearly but feel he made the right choice for himself. Story 6. It is truly the only humane option. If you do not believe that, then live with someone who has dementia or a severe chronic condition that is debilitating, painful, or disorienting. Not being able to call it a day and being forced to live for an indefinite period against your will is utter misery. Honestly, for anyone who says otherwise, I hope you never have to discover how wrong you are, whether firsthand or through someone else. Story 7. I believe providing people with that option is beneficial. There should be safeguards in place to ensure it is not abused or used maliciously, but it should remain available. Story 8. The way my mom tells it, it was definitely the right option for my great-grandma. She was diagnosed with cancer and had a few months left at most. It was only going to get worse. She was in her late 80s, and all her living family was in Norway, a 3-hour flight away. This allowed her to plan for a peaceful death with a view of her favorite forest and enabled her daughter, my grandma, to fly out and be there. The only thing she missed was a few months in a bed, alone. In contrast, my grandma on the other side of the family didn't have that option. She spent her last 2 months in so much pain that she couldn't enjoy anything and just slept most of the time. I didn't recognize her the last time I saw her. She was a strong woman and a former nurse with a sharp wit. By the end, she was barely mumbling, a skeletal old lady stuck in a sterile hospital, and I wish I never had to see her that way. Story 9. Good. I think my grandmother put it best when she said, "Mwahea hafiag." The last time I saw her, she is suffering from Alzheimer's disease with very little chance of surviving the next few days, possibly a week according to the doctor. She recently had her rib cage cracked to reach her heart in an attempt to revive her. Anyone saying life is too precious to allow this should first visit the palliative care wards. Story 10. The right to die with dignity should be standard everywhere. Watching How to Die in Oregon provides valuable perspective. It is an incredible documentary. Story 11. I'm from the Netherlands, where euthanasia is legal. It's a complex process to have it approved, but it is a valid option. Recently, it was also approved for mental suffering without any outlook for a cure or significant improvement in quality of life. I support this approach. I have always said that if I contract a disease that cannot be cured, I want to choose the timing of my death. I don't want to put my family through the experience of seeing me suffer, and I don't want to endure suffering myself. Please allow me to have a peaceful death while I am still mentally aware. Story 12. It is a wonderful option that provides relief from suffering and pain. It empowers patients who have felt powerless for years. Additionally, it offers closure to both patients and their families. I strongly advocate for it. Story 13. I support it. Those who do not support it do not understand how terrible it is to see someone fade away, enduring constant agony without anything that can be done to help them. It is also terrible to suffer like that. I saw a child in constant pain who could not live life properly because of it. Sometimes, death is the most merciful option for everyone involved. Story 14. I am offended by the notion that I am required to allow someone else to determine whether my condition qualifies as severe enough. I strongly dislike my situation and want to leave. However, I am not granted this mercy because I am labeled as just depressed. Others who have recovered from depression may be glad they didn't die, but that doesn't diminish my experience. I reject anyone who tells me I don't have absolute rights over my own life. Story 15. I believe that although there are potential issues that may arise, the ability to choose when to end one's life in the case of terminal or chronic health conditions should be regarded as a human right. Story 16. I believe this should be an option for everyone at or close to the end of life. Why do we have to endure the pain of stage 4 cancer instead of being comfortably assisted at the end? It feels cruel and driven by profit from insurance or government funds to keep us alive for another day. I apologize if I sound emotional, but I am affected by this situation. I have seen too much. Story 17. It is a humane action. Individuals should have the option to alleviate overwhelming pain with a sense of control and dignity. Story 18. I believe that if we do not have the right to end our lives, then we are born into de facto slavery. Therefore, I am passionately in favor of people having access to reliable and humane methods of ending their lives. They should not be required to have a severe and incurable medical condition to do so. Story 19. I have spoken with enough medical professionals who say that the extreme methods to extend life are unacceptable, and they do not want them. Hospice exists for this reason. Do not harm your 85-year-old grandmother just to keep her alive. Story 20. I would prefer to go at my own pace, with a smile on my face and in good spirits, surrounded by people who care about me, rather than wasting away like a weak, breathing skeleton, with those around me witnessing my slow, inevitable decline. Story 21. If a patient wishes to go, then let them. If a hospital or medical staff can offer a peaceful death, then I fully support it. Let people die with dignity. Story 22. I don't want to be hooked up to a lot of tubes while waiting to pass away. Let me handle it myself at that point. I don't want to waste away. Story 23. For anyone diagnosed with a terminal illness, it should always be an option, in my opinion. We cannot escape death, but allowing people to pass peacefully, planned, and surrounded by loved ones is far better than a prolonged, painful death, often miserable, where one wastes away slowly from the disease or illness that has led them there. We do not let pets suffer, yet we extend human life unnecessarily. Story 24. Suicide should be considered a fundamental human right for every individual, regardless of their medical status. Story 25. In principle, I support the idea. However, in a profit-driven healthcare system like ours, it would likely be abused. We are not mature enough as a country to handle it responsibly. The same system and professionals that fueled the opioid crisis should not be trusted with assisted suicide. Story 26. I don't mind it until the hospital starts using it as a treatment because healthcare is too expensive. It is already happening in Canada. Story 27. I hope that if I ever reach the point where I can no longer take care of my basic needs or remember my family, I can receive assistance. Story 28. I'm all for it. Obviously, I feel they should see a psychiatrist before it is approved. If I have a choice between going out in a horrible way over a potentially long period or going out on my own terms, I want to go out on my own terms. One of the problems is, of course, being mentally capable of giving consent. I had a family member who suffered from Alzheimer's and became quite suicidal during lucid moments. I believe there should be a way for a person in their right mind to express that if their mental state changes, they are comfortable with their decision on that matter if it arises. Story 29. I fully support it and am glad to live in a country where we are open to it. Medical assistance in dying is not quite the same, but it is an option. I have seen it implemented effectively in hospitals and other settings, and I hope it remains an option for me when I reach that point. Story 30. Your life, your choice. This becomes complicated when you are unable to communicate what you want. Then who gets to choose? Story 31. I think about abortion in a similar way. I am 95% sure I would never choose to have one, but I wholeheartedly support it being medically available because circumstances can change unexpectedly. I empathize deeply with individuals facing this difficult decision, and my heart goes out to them. Please do not turn this discussion into a debate about abortion. It is a complex medical issue involving lives and future lives, and it is just my opinion. Story 32. We have that option for our pets, and if we do not follow through, we are viewed as cruel owners. Why should we not extend the same kindness to ourselves? Story 33. I'm glad we had the option to remove my parents from life support. They both would not have survived much longer without it. It would have only been torture for my siblings, my parents, and me. Story 34. I would welcome this. I'm ready for this situation to be over. My children would be very upset, but they don't understand what my life is really like. I'm sure they would see such a decision as not caring about them or not loving them. That is far from the truth. I used to share some of what I go through, but they thought I was being dramatic. Story 35. I support it being an option. You should speak to a counselor or similar about a week or two beforehand. Story 36. I am a hospice nurse, and it is my life's passion. My idea of a good book is something about dying, death, or grieving. I wish a program for end-of-life compassion were in place. I would travel around all day offering hospice care and providing medications to alleviate suffering with the proper medical approvals. Being there with someone as they die is such an honor. I wish we had a more robust program to offer relief from end-of-life suffering. Story 37. I agree this should be an option as long as two doctors agree and either the patient or family agrees. However, there should be no life insurance payout because it was a choice and, more importantly, to prevent individuals from making this decision for financial gain. Story 38. It just makes sense. If my dog is in pain, I can choose to have them euthanized. But if I have to sit around and wait for an even more painful end? That's not right. Story 39. As someone with chronic health issues and persistent pain, I wholeheartedly support the idea. Although I am not there yet, in the coming years, my life may feel unbearable. After a lifetime of illness and struggle, I believe I should have the right to make that choice. Story 40. Human euthanasia should be legal. We allow it for our pets because we don't want them to suffer before they die, but somehow we are okay with allowing humans to suffer. Story 41. I am fully supportive of the request if it is made by the patient, either at the time or through an advance directive. I watched a relative pass away due to Alzheimer's disease. My deepest wish is to be able to determine a specific stage of the disease at which I could choose to end my life, because once I reach that stage, I will not have the ability to make that decision. Unfortunately, this means I will have to take control myself, which may require me to do so years earlier than I would truly need to. Story 42. I am terrified of not being able to end my life in these conditions. There are fates worse than death, in my opinion. The same applies to dementia. Story 43. My aunt had skull cancer and was told that they could remove it entirely, allowing her to live for more than 20 more years. They removed a large part of her skull, leaving her barely able to speak and heavily scarred. Unfortunately, they did not remove it all and the cancer spread to her brain. Instead of suffering in pain 6 months later, she passed away peacefully after enjoying a cigarette, something she didn't start until after her brain cancer diagnosis, and having some nice whiskey. She went peacefully while talking to my grandmother in her own home. My grandmother didn't even realize she had passed. It was the best treatment she probably received since the original diagnosis, especially considering she had to watch her husband suffer from leukemia. Story 44. I believe everyone should have the option to choose to end their life peacefully. I am 31 years old, but there is a high likelihood I will develop dementia, and I do not want to spend my later years in that condition. Living for many years in suffering when I could choose a different path is not something I accept. I will definitely choose not to endure that experience. I also have incurable cancer, which has limited my treatment options, and I feel strongly that I should have a choice in how I approach my end of life. Story 45. When my father needed euthanasia, I was relieved to live in a country where this was possible. It makes no sense to allow euthanasia for pets while forcing loved ones to endure a deteriorating and untreatable condition. Let people choose dignity. Euthanasia does not lead to more deaths. It reduces suffering. Story 46. Something must change, as currently, we provide unnecessarily pointless treatments and investigations to individuals who do not want them, cannot refuse them, and will not benefit from them, solely to appease our peculiar culture where death remains the only taboo. Our population of the elderly, frail, exhausted, and sick is gradually fading. We need to learn how to kindly and gently say goodbye and let them go. Story 47. Peaceful? Only for terminal patients? I disagree. I think it's good. People argue that assisted suicide is selfish, but what's truly selfish is forcing someone to exist in agony just so you don't have to miss them sooner. It's torturing someone at length just to put another's mourning on temporary hold, and that isn't good. Story 48. If you have ever had someone sincerely beg you to help them end their suffering because they cannot endure another day of pain, and you know their condition is incurable and they have tried all available medications and pain relief without success, then you understand how utterly selfish it is to expect these people to continue living simply because it may make others feel uneasy to allow them to pass. Story 49. If the patient and their loved ones have been properly consulted and all have agreed that it is the best option, I see no reason against it. Story 50. I used to be undecided. I could see the reasons for using it, but also some concerns about abuse. Then, I spent 4 months caring for my grandma in hospice and realized I had to keep her comfortable while she slowly dehydrated and starved to death. Those of us who took care of her had to defend ourselves to other family members who accused us of overdosing her on purpose. Tammy, I wish I could have done that while you wandered around her house doing nothing. By the way, why were you at her house packing up valuables while the rest of us were at the funeral? But no, let's make sure everyone is focused on who administered the last dose of morphine, how sleep-deprived they might have been, and how much it actually was. Yeah, that's the important part. Story 51. I am pro-euthanasia and have worked in a nursing home long enough to hold this view. I do wonder how others feel about euthanasia for children. I live in Belgium, where children have been allowed to request it for more than a decade now. The rules for children are much stricter than for adults. Their parents or legal guardians must give permission, along with the consent of a pediatric psychologist. The situation must be terminal, and the child must be conscious and of sound mind. There is no minimum age, as far as I know, but they are obviously not going to allow a 4-year-old to request assisted suicide. Story 52. Good in theory, but there would need to be a lot of oversight to ensure it isn't abused and that the patient is in a state of mind to make the decision. Story 53. I firmly believe that you should be allowed to die as you choose. If you are of sound mind and wish to make an end-of-life medical decision, that is your right. Story 54. In theory, it is a great idea, but one must be very careful and implement strict regulations to prevent abuse. One of the most challenging times for a family is when there is a death and inheritance money is involved. Adding the thought, if Grandpa ends it now, we will receive the money sooner, makes the situation even more difficult. Story 55. I would appreciate the option. It would provide me with the motivation to get everything sorted by the determined date, and then I could go to the hospital to receive assistance. Story 56. As a chronic pain patient with no cure, and each year bringing more issues with increased pain, I would support it. One stipulation I would suggest is to keep all politicians out of the decision-making process. Story 57. It should be an option for everyone, whether ill or not. I firmly believe there should be places where people can choose to end their lives if they wish. It is nobody else's business. Story 58. I'm here for it honestly. I also remember when my grandmother was in her final days and how frantic we were to keep her with us. She lost all higher brain function and never recognized me again. I just wanted 2 more minutes with her, but she died before we reached the hospital. These are the 2 struggles I experience in my mind every time I see this question posed. Story 59. Love it. Offer it for anyone tired of this exhausting grind. Free individuals should have the option to choose when and how they want to die. Story 60. About a month ago, on a sunny Sunday morning, we all gathered in my father-in-law's hospital room. We talked, made jokes, and said goodbye, much cheerier than I had imagined. He had been given a 0% chance to survive, with an estimated 3 months to live for months prior. He was close but probably had another 3 weeks of some of the worst pain known to man, in addition to hallucinations, a complete lack of dignity, and other problems. His last words, aside from consenting to the procedure, were a joke. Then the doctor gave him a large syringe full of Valium, which allowed him to relax for the first time in ages, followed by propofol to put him to sleep, and then something else to finish the job. We paid our respects and shuffled out. I have witnessed a number of deaths due to cancer, and they were all completely horrific. The dying part of this one was still pretty bad, but the death itself brought peace not just to my father-in-law, but to the whole family as well. Story 61. I am okay with it as long as they are not doing it as a way to obtain your organs. I wholeheartedly believe that if someone no longer wants to be here, it should be their choice, and the healthcare system should make it easier for them instead of complicating matters and creating unsafe situations. Story 62. I support the idea. I have witnessed how people can suffer towards the end of life, but I am aware of the reality. There are situations where medical intervention is no longer effective or offers no improvement to the quality of life. I believe individuals should have the option available to them. Even if they choose not to take it, having control over some aspect of their condition can be a form of relief in itself. Story 63. I hope we all have the option of euthanasia if we are mentally capable when making that decision for ourselves. Story 64. In every aspect, it's unwise to allow it. Regarding finances, it may be better for a patient to pass away now than to keep them alive for years on a combination of medications. For the patient, it is preferable to say goodbye when you can, rather than suffering for years just so the system can claim they are alive. For the relatives, it's better to say farewell now than to witness a loved one slowly deteriorate and vanish, only to receive the news that the body died long after the soul has departed. Story 65. I believe offering voluntary euthanasia for those with incurable conditions is fair. Many of these conditions, especially in their final stages, can be excruciating. People are allowed to stop treatment for a condition they know will ultimately lead to their death. What I am concerned about is the euthanasia of individuals with mental health disorders. I have experienced depression, anxiety, and childhood trauma. I cannot speak for everyone, as each person's trauma is unique, but one's mental state can change continuously. You might want to die for a period and then desire to live afterward. Therefore, I do not support euthanasia based on mental health conditions. However, if you are facing organ failure, severe infections, or terminal cancer, I believe you should have the option to end your suffering prematurely. Story 66. It's not something I would be able to do or administer to others. I think it makes sense if a patient is asking for it, but it should be administered by someone who would not feel guilty doing the same, and only when every possible medical option has been exhausted. In the end, you are ending a life whether they wanted it or not. Story 67. I wish they offered support for mental illness as well. Mental illness has physical effects on the body and does not always have a cure. We deserve options as much as individuals with conditions like cancer, especially when methods of trying to end our own lives can lead to permanent disability when unsuccessful. Then we find ourselves in an even worse situation. Story 68. If I had a severe, incurable condition, I would want to find relief, seek companionship, and explore various experiences. Story 69. I have worked in end-of-life care and I am a strong advocate. It provides options and gives control back to the patient and their family. Story 70. It should be a given for people who are clearly in pain and near death. Why prolong suffering? Story 71. I think it is a very kind thing. If you do not like it, then do not use that option. For some people, certain lives in a hospital are not worth living, and a peaceful end is a generous offer. Story 72. It sounds reasonable on the surface. Morally speaking, I would say it is the right thing to do. However, we should also be cautious about it. This is already an option in Canada and now accounts for about 5% of all deaths. There are concerns about governments, hospitals, and activists pushing it on people too hard. I think these concerns are broadly legitimate, and we need to take them seriously if we hope to manage the practice responsibly enough to justify its existence. I do not know anyone who has had or plans to have this done, thankfully, but I find much of the online rhetoric around it to be rather disturbing. People celebrating death and exalting the freedom to die in a world where too many other freedoms are lacking. This seems detrimental to our overall psychological and cultural health, especially in an era when we are advancing rapidly in medical technology and could progress even faster if more funding and effort, along with less bureaucracy, were allocated to it. We should be having far more serious conversations about radical life extension, cryonics, and transhumanism than the ones we are currently having about medical assistance in dying and the so-called freedom to die. Right now, public discourse seems skewed toward the latter. Story 73. I believe that a person's body is their own, and they are free to do what they want with it as long as no one else is harmed. If someone is suffering, why are they denied a dignified death? If a person wants to die, isn't it safer for them to do so in a controlled environment rather than at home, where family members might find them and be traumatized, or where they might do it incorrectly and harm themselves? Story 74. They already do. It's called hospice. They were wonderful after my father had his fatal stroke. Story 75. It is a very challenging topic. Having watched some family members in their final days and weeks suffer while awaiting the inevitable, there is significant appeal in allowing individuals to end their suffering on their own terms and while they are still coherent enough to make such a decision. Story 76. There is a clinic in Switzerland that does exactly this. I fully support it. Story 77. I support it and I do not understand why anyone would not. However, it should be better safeguarded at times and not promoted as much as I have seen. Instead, it should be available only on request. Story 78. It depends on whether you are seeking hospice-level peaceful end-of-life options, where the goal is to make the transition easier and less traumatic, or if you are considering euthanasia. I support the first option, and nearly every hospital has it available if you request it. A do not resuscitate order is essential. No one will accept your word alone. You must have the signed document. Some religious facilities and professionals are less willing to accept a do not resuscitate order. Regarding active euthanasia options, please note that the cost of care may become a deciding factor for some, though not for everyone. Story 79. What is incurable for you and what is incurable for Jeff Bezos are not the same. In practice, any kind of system like this will devolve into barely sanitized eugenics. Story 80. If it doesn't get twisted into something classist, I will be surprised. Oh, you don't have money to pay your bill? Does that guarantee you a difficult life? We can help. Just reach out. Story 81. In theory, it is great, but I believe it can go wrong quickly with greedy capitalism. Additionally, if you are religious, that may also influence the situation. Story 82. In theory, it sounds like a great option for people who are dying slowly and painfully to find a bit of peace at the end. In practice, it could inevitably turn into eugenics. The only procedure covered by state-provided medical coverage at this point is medical assistance in dying. Story 83. Canada implemented a system that led to hospitals and medical professionals promoting end-of-life options excessively, as the process for ending lives became highly profitable. Investigate the scandals surrounding their medical assistance in dying system, which began approximately 10 years ago and has since resulted in numerous court cases and controversies. Some examples are truly disturbing. What began as a well-intentioned effort to assist those in need spiraled out of control due to profit motives. While I empathize with the situation, it seems like a precarious slope that could claim lives of individuals who still had the potential to thrive. It provides hospitals an easy solution for challenging patients, while also offering a means to gain financially from their deaths. Story 84. Canada implemented a system that led to hospitals and medical professionals promoting end-of-life options excessively, as the process for ending lives was financially rewarding. The scandals surrounding their medical assistance in dying system began about 10 years ago, and now numerous court cases and controversies are emerging. Some examples are quite dystopian. What started as a well-intentioned effort to assist those in need spiraled out of control due to profit motives. While I empathize with the situation, it feels like a slippery slope that could lead to the deaths of individuals who might have lived fulfilling lives. This provides hospitals with an easy solution for challenging patients, while also offering a financial incentive tied to their deaths. Story 85. It's a slippery slope. There have been times in my life when I considered suicide, but I never went through with it. I'm happy I didn't because now my life is much better. While end-of-life services may seem appropriate at the time, they may not be the best choice in the long run. This isn't a black and white issue. If someone is suffering from a terminal illness like cancer, I can understand the argument for end-of-life services. Story 86. I disagree with this. Sadly, I have encountered too many doctors who would extend this to people in order to avoid actually treating them. That is true. Even when it starts as being for severe, incurable conditions, it always gets expanded beyond that scope. Story 87. They already do. It's called palliative care, and it's quite effective. I wish this was discussed more openly when this topic arises. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.